Assalamualaikum warahmatullahi wabarakatuh. My name is Sharon binti Harzaman. My meeting number is TE17001. I would like to present my final year project 2. The title is IoT based patient health monitoring system. My supervisor name is Prof MADYA TS Dr. Muhammad MAHADI bin ABDUL JAMIL. Introductions for this project is nowadays health monitoring is a major issue. Due to a lack of proper health monitoring, the elderly face serious health problems. The benefit of this smart device is that they can keep an eye on the elderly. In hospital, can the health status of elderly people be determined when they are on a bed? These monitoring devices are only available in hospital and are constantly attached to the body of the elderly. Many of them are difficult to use, so doctor and family members must have a handy device that monitor their elderly patients when they are not present. By developing monitoring system, the aim is to reduce healthcare costs by lowering physicians' office visit, hospitalizations, and diagnostic testing procedures. This project will create an IoT-based health monitoring system that monitors the elderly heart rates and body temperature. It will send notifications and email alert when those reading exceeds in a critical values. Pulse rate and body temperatures reading appear on the Blink apps, which can be accessed from anywhere via the internet to monitor the health of the elderly. The data will be exported to CVS and email. Excel will be used to view the data. Next slide is problem statement. Elderly people with disabilities want to remain in their homes even when their health condition worsen. Elderly people are often left at home because their children work and stay far away. So no one knows the real-time situation for elderly people. Most children have difficulty closely monitoring elderly people continuously if they are working far away. Next, it is commonly available via a local connection such as Bluetooth, which is for limited area only. Finally, the problem is the monitor device is not friendly due to a wired connection, so this situation need to be addressed so that the system is more user-friendly via a network-based system such as IoT. Next slide is objective of this project. The objective of this project is to create a health monitoring system capable of producing and recording elderly people's body temperature and heart rates. The second is to transfer the data produced into the Blink applications, and finally is to create an alert system for the user via notifications and email when they are in a critical condition. Next slide is the scope of this project. This device was designed to measure the heart rate and body temperature, and the second is data will sent through the internet via the Blink applications, and finally the data and alert system such as notifications can be viewed through the Blink application and email it by export to Excel. The next slide is literature review. For the previous concept, the healthcare monitoring system which used CP that can assist residents in checking parameters at home. It helps the public by providing healthcare services such as medical monitoring, memory enhancement, medical data access, and emergency SMS communication with healthcare providers. For the project IoT-based patient health monitoring system, the Brain software is used by patient health monitoring to check the temperature and pulse sensor data of elderly people. The notification will appear if the information is in an abnormal stage. The next is for the previous concept is create a remote healthcare monitoring system that will care for the elderly and chronic patients in their homes while also providing care facilities. This remote monitoring system also includes smartphones, wireless sensor, web server, and IP webcams. For the project IoT-based patient health monitoring system, this system also monitors the elderly and includes mobile phones, wireless sensor, the Blink application, and the way to export data to an email by outsourcing to Excel. Finally, for the previous concept is it uses Bluetooth. Bluetooth is a wireless transmissions interface that allows sensor data to be sent to a smartphone. But for the IoT-based patient health monitoring system, it uses and employ the ESP826601 serial Wi-Fi transceiver model that is a self-contained SoC with an integrated TCP and /IP protocol stack that allows each and every microcontroller to connect the Wi-Fi connections. Next slide is methodology. The picture shows the block diagram of monitoring system, which is include the S18B20 digital temperature sensor and a heart rate sensor. The Arduino Uno microcontroller will be directly connected to the DS18B20 temperature and heart rate sensor. Coding will instruct the microprocessor to obtain the current temperature and heartbeat result. The received development will be transferred directly through the mobile application via the internet. As the result, user can read the result from any location using their smartphone and transmit data to and from the internet. Furthermore, it can grant access to the Wi-Fi network to any microcontroller. It is used to send data directly to the Blink application to view the data collected by the DS18B20 temperature sensor and heart rate sensor. The progress will be displayed in real-time graph, and the user will be able to monitor the temperature using the Blink application. The data will then be transmitted to the user via notification. When the condition become abnormal, it detects them and alert the people nearby by popping the alert system and sending an urgent message and email. Finally, the data will be exported to CVS and sent via email in form of Excel spreadsheet. The entire circuit is completed on the following slide using FreeZine software: an Arduino Uno, a pulse sensor, an ESP826601, and a 12C LCD are the components that have been used. There are 3 pins on the DS18B20. The first pin is the VCC pin, the second is Vout, and the third is ground pin. VCC and ground are connected to the VCC and ground pin. It provides 5V power to the Arduino board. The DS18B20 output pin is connected to the digital PWM pin on the Arduino, which is 10. The pulse sensor module has 3 terminals, which is VCC, ground, and out. The A0 Arduino analog pin is connected to the output pin of the pulse sensor module. The VCC is connected to 5V DC output of an Arduino, and the earth is connected to common ground. To connect to the cloud, the ESP826601 Wi-Fi module is used. It is safe to connect to the Arduino board using a Wi-Fi router. The following slide is a flowchart of this project. When to start the project, data will be collected from the temperature and pulse sensor. When the temperature and pulse sensor detect each other, the data will send to the LCD. If the data cannot be detected, it is routed to the temperature and pulse sensor. The Blink app will be then checked to see if there is an internet connection. If so, the data from the temperature and pulse sensor will be sent to the Blink application. If not, it is necessary to check the internet connection via Wi-Fi. An alert notification and an email will be sent if the temperature or pulse sensor shows a high reading. If to expose the data to CVS, the data will be sent via email in the form of the Excel spreadsheet. The following slide shows the result and discussion. This image displays the Blink application interface. Blink was used to collect all the data. To create an account, users must first deregister. The OATS token will then be sent to the registered email address by Blink. Users can use the apps to create their own data after receiving the OATS token, such as superchat, display values, notifications, events, and so on. It can be viewed in real time: 1 hour, 6 hour, 12 hour, 1 day, 2 day, and 3 day on superchat. When reading exceeds critical values, a notification and email alert will appear. For the example is alert BPM is high and alert temperature is high. The next is video demonstrations. The following slide contains data and graphical data. Different data parameters are recorded every second. These include heart rate and body temperature, which are transmitted in CSV format via SL report feature. The current study research look at 3 people, the specific of which are provided. By click the graph of superchart, the symbol of dot in the Blink application, then export it to CSV. The data will be sent to the email address. The outcome will be displayed in Excel. In Excel, it displays the BPM, temperature and that date along with the time that was recorded. The result shows the people 1, 2 and 3 in good health. The following slide is a validation table. It includes the average BPM value by pulse sensor by Earth's prototype and the average BPM value by X7 smartwatch, the average temperature value by DS18B20 by Earth's prototype, and the average temperature value by thermometer. As a result, it is reasonable to conclude that the prototype performed very well in measure BPM and temperature in a manner comparable to that of a standard device with a deviation of less than 1%. The average of pulse sensor and the temperature sensor is taken every 15 seconds because photosensor signal is generally small and noisy. It is passed through NR/C filter network before being amplified using an optional amplifier to reproduce a signal that is much larger, smoother and easier to diagnose. The conclusions of this project is IoT-based patient health able to monitor system can be implemented using microcontroller with appropriate sensor and a Wi-Fi module. This monitoring system can be flowed anywhere if have an internet connection. The disadvantage is Wi-Fi problem. Sometimes the connection is bad and it is hard to send data to internet. It can be good to use a higher level Wi-Fi module for a high quality internet connection. Although the cost of this project is low, it is possible to design a more cost-effective patient healthcare monitoring system. Finally, this IoT-based patient monitoring system performs admirably. An LCD screen and a variety of visually such as a value display and a waveform, which is by using superchart, are used to support monitoring in the internet-based Blink application. Measuring and monitoring of heart rate and body temperature is possible with this system design. The next slide is recommendations. In future, many accurate value sensor can be used in systems with lower noise rates. Furthermore, create more wearable sensors such as wristband or combine sensor with clothes such as bright t-shirts and intelligent hats. Next, utilize superior mobile network providers such as 4G providers. It is because the entire system necessitates an consistent power source. Conventional power source such as solar energy with additional backup batteries could be used as the system primary power source. Moreover, additional parameters can be measured by the device. For the example is blood pressure. And finally, a system that can provide multiple phone numbers, which is allowing multiple users to receive an emergency message. That's all from me. Thank you.